What is alpha-2 macroglobulin and why should you care about it? Hi, this is Dr. Dumitrescu again. Wouldn't it be miraculous if within your own bloodstream you were carrying around a biologic treatment for your arthritic knee or for your degenerated lower back? Well, it's true. Your body creates a very large protein in your liver, which is carried via your bloodstream to various organs. This protein has several important roles that keep you healthy. This protein is called alpha-2 macroglobulin, or A2M, and it is among the largest and heaviest proteins that your body makes. It is naturally occurring in your blood. Its principal activity is to counteract the enzymes that break down cartilage and other tissues. This very large protein called A2M can capture and neutralize the chemicals created in an arthritic joint or indeed in an intervertebral disc that cause the destruction of the articular cartilage. By reducing these destructive substances, A2M effectively halts the progressive damage seen and felt in the osteoarthritic joint. For those of us involved in the care of the arthritic patients, this is really a huge advancement. Before explaining this new treatment further, let's first put the problem of osteoarthritis, or OA, into a larger perspective. The Centers for Disease Control estimates that some 27 million adult Americans are afflicted with osteoarthritis. Furthermore, it is estimated that 1 in 2 adults will get symptomatic knee osteoarthritis in their lifetime. With the combination of the aging baby boomer population, increased longevity of the US citizens, and of course the obesity epidemic, the rising prevalence of osteoarthritis is expected to contribute even more heavily to the severe health and economic effects already present. Osteoarthritis often causes weakness and disability, interferes with work productivity, and often results ultimately in joint replacement. Disappointingly, we currently only have treatments that aim to alleviate the pain of osteoarthritis. The non-steroidal anti-inflammatories, the aspirin, Tylenol, the cortisone injections, and also the viscosupplementations, and so on and so on. None of these treatments actually alter the disease progression of the osteoarthritis. They are not biologic treatments for this problem. What we have not had available so far is a true biologic treatment that alters the course of eventual destruction of the arthritic joint. A treatment that actually halts the progression of deterioration of the articular cartilage, which, when finally worn completely away, leaves us with little to do but to consider again a surgical solution such as a joint replacement surgery or indeed lumbar fusion surgery. What we have been looking for is a true biologic treatment of osteoarthritis that effectively stops the deterioration of the joint. We think that alpha-2 macroglobulin may be the treatment. Osteoarthritis turns on various destructive and inflammatory chemicals that are called proteases. This results in damage of the articular cartilage, and over time, if unchecked, this process will lead to the loss of protective cartilage covering the joint and the development of significant and limiting joint pain or back pain. A2M has 2 binding sites to which these proteases are captured. This interaction permanently changes the shape of the A2M and creates a condition where this complex can now be broken down and eliminated by the body through natural mechanisms. A2M inhibits cartilage, catabolic, and inflammatory proteases and effectively stops the cartilage degradation and joint destruction. A recent study from Brown University has tagged A2M as a master inhibitor of cartilage degrading enzymes. It acts not only by blocking the activity of the destructive proteases, but it also suppresses the expression of the genes that increase the protease levels in the joints. The conclusion of the study was that A2M protects joint cartilage if present in high enough quantity. Therefore, we believe that supplemental injections of alpha-2 macroglobulin into the painful joints or lumbar discs may diminish the cartilage degeneration and may be a potential therapy for osteoarthritis and disc degeneration. In short, if it was possible to get more of this protein into an arthritic joint early in the arthritic destructive process, it is quite possible to at least slow down, if not halt, the progression of joint deterioration. This would be the first truly biologic treatment for a condition that has plagued us for a really long time now. Your liver actually makes a significant quantity of alpha-2 macroglobulin, and alpha-2 macroglobulin circulates in your bloodstream in reasonably high quantity. So now you may be thinking, well, why doesn't this protein just end up in the joint and help out? And this would be great if it could. Unfortunately, A2M is just too big of a molecule to cross over into your joint in sufficient quantities to effectively stop those destructive chemicals that have been turned on and are destroying your joint. If only there was some way to get A2M from your bloodstream and into your arthritic knee or degenerated disc, that would be a real breakthrough in treating arthritis and disc degeneration, wouldn't it? Well, just recently we have learned a method whereby your own blood is collected and processed with a centrifuge and a special filter. This process yields a small quantity of highly concentrated A2M with some platelets that can be directly injected into any osteoarthritic joint or lumbar disc. This method reduces the white cell count in the preparation to negligible levels, thereby allowing the concentrated alpha-2 macroglobulin to more efficiently neutralize the chemicals that destroy the joint, the proteases. This method concentrates the A2M to a level 9 to 10 times the concentration found in a bloodstream. This system received clearance from the FDA for use in humans in the early 2014. The initiation of clinical trials with alpha-2 macroglobulin has been approved by the FDA also. This marks the beginning of the era of targeted osteoarthritis therapy with enhanced version of A2M currently in development. As usual, a few words of caution. This biologic treatment works best in joints where the destruction has not reached the point of total destruction, or where the joint is bone on bone. This is referred to as end-stage arthritis. A biologic treatment that is designed to help slow or prevent further destruction will, of course, have little effect when the destruction of the articular cartilage has become extreme. This would be analogous to calling the fire department after your house has already burned down. This treatment is FDA approved for the treatment of mild to moderate osteoarthritis. This new treatment is not the platelet-rich plasma or PRP concept that has been available through many companies for over a decade and is typically used in the sports field, and we use that a lot too. This system minimizes platelet and white cell concentrations while maximizing the concentration of the desired cartilage protective protein alpha-2 macroglobulin. This is wholly unique in the populated field of PRP systems currently available. If this cutting-edge therapy appeals to you, contact our office directly to set up an appointment to see if you are a candidate for this unique and tip-of-the-spear biologic treatment for your arthritic joints or intervertebral discs. Thank you.